Hello, my name is Lynette Allen, and I want to welcome you to the Lincoln Trail Area Extension Homemaker lesson, Stand Up to Falling. I am the FCS agent in Breckinridge County, and I am happy to share this lesson with you. This lesson was developed in partnership with the UK Healthcare Level 1 Trauma Center and the UK College of Food and Environment Cooperative Extension Service. There are several publications that go along with this program, and I will highlight a few of those throughout the PowerPoint. Let's begin by looking at some of the statistics on falls. In a given year, 1 in 3 older adults, 65 plus, can expect to fall. Falls are the leading cause of injury and injury-related death for individuals 65 and older. Falls are the leading cause of trauma-related hospital admissions for 65 and older, and 50% of those who fall and have fractured hips never return back home. If we look at Kentucky specifically, we have over 35,000 older adults who are treated with fall-related injuries between the years of 2016 and 2019. Over 9,000 adults are hospitalized every year. And then more than 200 older adults die each year from the consequences of falling. Unfortunately, my father experienced this with a very serious injury from falling, which led to his death. When we think about falls for older individuals, we can quickly think of the types of injuries that it causes: hip fractures, traumatic brain injuries, and then of course the bruising that we see that is so bad with falls for older individuals. Falls are one of the main things that if we can prevent those, we find that people can stay longer in their homes, and research shows that people who are able to live longer in their homes, in fact, do live longer. People are not falling because they are old. That is good news. People fall due to a number of internal and external factors, and we're going to spend the rest of this, or the majority of this program, just looking at those internal and external factors. We know that risk factors, when we talk about internal factors, we're talking about the things that are within ourselves. And then external factors are those things outside of ourselves that influence us. Internal factors represent normal age-related changes, such as problems with vision, weaker muscle strength, poor balance, or walking problems. Also neurological or cognitive disorders such as Parkinson's disease, stroke, side effects, Alzheimer's, those types of things play into fall risk. And then also more common everyday ailments like arthritis, diabetes, circulatory disease, depression, reactions to medications also are internal factors that can occur that increases the chance of falling. External factors are those things surrounding us that can cause falls. Our home environment, or just whatever environment in which we spend our time in. Medication side effects of alcohol, assistive devices such as canes and walkers, and footwear. When we look at this picture specifically, we see this lady does have a walker on wheels to assist her with her walking and to steady her. But then also there's and it can be very beneficial, but it can be a hazard if not handled correctly. And there's one other thing in this picture that can be a fall hazard, and that is this beautiful dog here. And we'll talk more about pets as we go. The CDC has recommended or identified 4 areas in which we can take action and control risk factors for falling. And that is vision impairments, unsafe home environments, medication usage, and lack of physical activity or exercise. When we look at the common age-related vision impairment that may lead to falls, it is referring to things like increased sensitivity to glare and light changes, and we find this in individuals with cataracts and other eye disease conditions. Also decreased ability to see in dim light. As our eyes get older, it takes them a little longer to react and refocus as we move from well-lit areas to dim areas. Also, the decreased ability to see contrast, especially in colors that are similar. For example, blues, purples, and greens can appear very similar. Decrease in color sensitivity, and that would relate to those colors again. Decreased depth perception, not being able to judge the height or depth of like when climbing steps or stepping across thresholds into from one room to the other, or walking outside when the ground may be uneven, or stepping down off of a curb can cause a fall hazard. And then also just decline in visual acuity or sharpness. The edges of things or sidewalks may not seem quite as clear. Vision impairment and falls continued with this slide, and it's what can we do to accommodate for these vision problems. Well, we can use sunglasses, wear wide-brimmed hats, try to select non-glaring surfaces for our floors, countertops, things like that, and cover our windows with sheer curtainry that would allow the light to still continue in, but not be a sharp glare. Also, we need, like I mentioned, give our eyes time to adapt to light as it's changing. And then make sure we have properly lit workspaces in our kitchens, our bathrooms, and in areas like our hallways, stairwells, and other rooms. Use contrasting colors on the walls, stairs, and toilets. And the picture depicts this very well. We can see the black stone work or tile work along the bottom half of the wall really draws contrast with the toilet, so it's very easily seen. If you'll notice, the base of the toilet sort of blends in with the floor where you have that white on white. So using contrast of colors on walls, stairs is very important. Be familiar with the environment, keep it clutter-free, and take extra time as you navigate up and down steps. Proper prescription lenses for eyeglasses is important to keep those current and up to date, and be careful with multifocal lenses. Bifocals, trifocals can cause some depth perception challenges as you're walking up and down steps. So a single focal lens is often better for when navigating stairs. And then again, it is so important to have regular eye exams. 50 to 75% of falls happen in the home due to hazards that we overlook every day. So as we move through our home, we can check and look for hazards and make corrections. Adding that proper lighting where needed, handrails to stairs, remove or tack down rugs or carpeting, and clean up spills. Also, we can secure electrical cords along baseboards to make sure they are not trip hazards. Remove any clutter that may be sitting around as far as shoes, boxes, anything that may cause us to trip and fall. And then we all love pets and small children. But we do need to be aware of when they are around that can pose a fall hazard. It's very important for pets to be trained to stay on a sit and stay commands so that as an individual rises to walk, the pet stays in place until the person is ready for that pet to also stand up and move. In our kitchen, we want to keep our cooking equipment and utensils handy. The things that we use on a daily basis, keep those easily within arm reach so we're not having to climb on stools or chairs. In our bedroom, a bedside table is handy, a good sturdy bedside table with a lamp that is close to the side of the bed so it's easily reached. And then in our bathrooms, we want to install sturdy hand grab rails around the shower tub and beside the toilet. Often you hear of people who fall in the bathroom and they will reach out to grab a hold of a towel bar, which they are not designed to support the weight of a person. So going ahead and installing the grab bars is really important. This is one of the publications that this PowerPoint is based on, and it's the Home Safety and Fall Prevention publication in the Stand Up to Falling series. And it has some text to it, but then also this is a snapshot of the checklist that's in this publication that you can use to go throughout your home and just look for those hazards and ways to correct those. So this is a good publication, very hands-on, that will help you address any fall issues in your home. Next, we'll move on to mobility aids or assistive devices, and this includes canes, walkers, and wheelchairs. And the important thing to remember here is these items need to be fitted to the individual by a physical therapist or their healthcare provider to make sure canes are at the right height, that walkers are fitted appropriately. Like this walker is referred to as a pickup walker, in which the person has to pick up the walker with each step and set it back down. So they have to be able to stand up straight and have arm strength to be able to lift that walker as they step with each movement. If they cannot do this, you often see individuals that will end up pushing the walker, in which that can be a fall hazard because if they hit carpet or a threshold at a door, that walker can tip forward then with them. So having the appropriate type walker is very important. Wheelchairs are so helpful, but also it needs to be assessed whether a wheelchair will navigate throughout the home, through the doorways, into the bathroom, bedroom areas before the decision to get a wheelchair is made. Proper footwear. We do want to stay active, up and going, and so having good, comfortable shoes that will help us protect our feet is really important. You want to have proper fit. So it's always important to try on your shoes, and as the day goes, our feet swell, and being able to shop for shoes in the afternoon is much better than the morning, because that's when our feet are the biggest, and that ensures a good fit all day long then. We want a slip resistant sole, and then low heels. If you do have a shoe with a heel, it should not be more than an inch to an inch and a half wide or tall, and 2 inches wide. Medications. This is where we can have some problems with dizziness or reactions to medicines that can create fall hazard. Research does show that for individuals who take 3, 4 or more medicines, their risk of falling does increase, and that's due to those interactions between those medicines. So it's always important to talk with your healthcare provider about any medicines that you take over the counter and that you've been prescribed. Keep a list, a chart of what you take, when, and for what condition. As you're taking your medicines, be sure to check labels, make sure you are picking up the correct bottle, and then take the medicines in the correct way at the correct time, because you want to be sure and that you're following the directions so the side effects are as minimal as possible. And then if you do experience side effects, you want to be sure and talk with your healthcare provider about that. Always consider the do's and don'ts. For example, you would not want to take a medicine that causes drowsiness in the mornings if you don't have to. If those are a lot of times prescribed at night, so you'd want to be sure and take those when the correct prescribed time. Also, things like foods, waters, do not drive, just all those types of common types of do's and don'ts will be noted on your medicine information sheets, and you want to, and labels, so you want to be sure and pay attention to that. When you are at the doctor, and here are some questions that you would want to be sure and ask about your medicines. What is the name of this medicine? Why am I taking this medication? How long will I need to? What should I do if I miss a dose? Do I go ahead and take it or wait until the next prescribed time? And then what side effects are common with these medications? And if I do experience side effects, what should I do? And then be sure and mention again, any type of vitamins, home remedies, or over-the-counter drugs that you may be taking to guard against any interaction. There is a second publication. It's Stand Up to Falling Medications, and it will include a checklist log that you can use to fill out, have all your medicines listed on, and you could take it to the doctor's appointment and have this discussion with them. Just as a caution, there are medications that can cause dizziness. So if you happen to be on one of these, you'd want to give yourself extra time when you're moving around to settle if you experience dizziness. For example, if you rise up out of bed, you may feel some dizziness. So you just want to sit there on the edge of the bed for about 10 seconds to let that dizziness settle, let yourself become more steady before standing. Also, it's important to stay hydrated and to drink plenty of water. And then, of course, exercise and walking is important for your overall health. But if you do experience dizziness during this time, you want to just take that in consideration and make sure you stay safe. Alcohol and falls. We all know that alcohol can increase the fall risk, and even small amounts can be dangerous. And as we age, we do not, alcohol can affect, it takes it longer for alcohol to process through our bodies, is what I'm trying to say. We can still feel the effects of alcohol longer. Of course, mixing alcohol and medications can be very deadly, so we have to be very cautious of that. And again, pay attention to those do's and don'ts on your medication information sheets. That leads us to this slide that talks about inactivity and falls. There is this fear of falling syndrome that occurs, and the way it works is we have a person that may fall. They may be injured or they may not, but it causes them to be anxious and worries about falling. So they develop this fear of falling again. So they reduce their activity or limit their walking and movement, which causes decreased muscle strength and balance, which we realize increases the risk of falling, which could lead to another fall. So strength, balance, and flexibility is so important to reduce the risk of falling. But if we are afraid of falling, we often don't move to keep our strength and balance. So it's a circular thing that just feeds on itself. So next, let's talk about physical activity and how it can prevent falls. Exercise that we do as we get older should be sure to include strength, balance, and flexibility. First, we'll focus on strength. This helps our muscle tone. It aids in balance and just helps us be able to move around. Decreased muscle strength is associated with falling, and 30 to 40% of muscle mass is lost by age 65. But the good news is we can always build that strength back and muscle mass back. We're never too old for that. With increased strength, we're able to be more independent, and improvements in our ability to be able to carry out our daily activities. Here's an example of a very good leg strengthening exercise that we can do even while we're watching TV. Just sitting in a chair and raising our leg and pointing our toes to the ceiling and then stretching it back out straight, pointing our toes to the ceiling, and you would just repeat that 10 to 15 times, and then raise the opposite leg and repeat that 10 to 15 times on that side, and then go back and start again on the other side and repeat that whole cycle about 10 times. Balance. Weak leg muscles, poor vision, and slow reaction time increases in older adults' chance of falling. And research is starting to show also that if you have reduced hearing, that can play into your balance and cause you to be at a higher risk for falling. Medications can affect our balance, medical complications. So balance is something, again, that we can work on. And here's a simple stand on one foot and just see how long you can by holding onto a chair to keep your balance, or in the kitchen at the countertop. It's a great place to practice or to work on this. Stand on one foot for 10 to 15 seconds and then lower that foot and stand on the other foot, and just repeat that cycle for 10 to 15 times a day, once a day. Flexibility. Flexible muscles allow you to move smoothly, avoid muscle tension, and protect your body from injury. As muscles stiffen and joints get sore with age, older adults, we begin to lose flexibility. Stretching is one way to keep the body flexible. Stretching improves performance, reduces risk of fall and injuries, reduces muscle soreness, helps improve posture, can help relieve back pain, helps you enjoy exercise, and reduces stress. Here's a very simple, easy stretching exercise for our core or back, and that is just sit in our chair and just twist to one side slowly. Hold it for 10 to 15 seconds, and then turn around and twist to the other side and hold for 10 to 15 seconds. And then you would just repeat that 3 to 5 more times. What to do if you should happen to fall. Try not to panic. I know that is hard to do, but try to stay calm. Take several deep breaths to try to relax so that you can calmly assess the situation and determine if you are hurt. If you are hurt and cannot get up, ask for help or call for 911. Hopefully you're not alone, so you can just call out to someone, or you can reach your phone to call for help. If you are alone, try to find a position, a tolerable position, until help arrives. And then also at this time, I'd like to encourage you to consider personal emergency response systems. Those are a great way, especially if you're living alone, to have something like that you would always have within your reach. My grandfather lived to be over 100 in his home. He would have help that came in during the day, but at nights he was always by himself, and he kept a call response system on a lanyard around his neck so that if he should fall, he was able to easily call for help. And then nowadays with cell phones, portable phones, it's so easy to keep something like that in your pocket, or if you're on a walker, use a walker, keep that, attached to a carry pocket on your walker. This demonstrates the safe way to get up from a fall. It says roll over naturally, turning your head in the direction of the roll. You can crawl, if you can, crawl to a strong, stable piece of furniture like a chair to pull yourself up from. Be sure to approach the chair from the front so that you're not pulling the chair over on you from the side or the back. Slowly begin to raise one knee at a time, and then slowly twist around and sit in the chair. So this brings us to the end of the presentation. Just to review, what can you do to prevent falls? Daily physical activity is the best thing to keep your strength, your balance, and your flexibility up so that you can move about as easily as possible. Get regular vision checkups. Assess your environment or your home. Make sure you do not have clutter or other trip hazards. Have your medicines reviewed to make sure you're not getting interactions between medicines that would cause you to be dizzy. Have your blood pressure checked when lying and standing to know if that you may experience low blood pressure as you transition from each position that may cause dizziness. Wear safe footwear. A good secure shoe to protect your foot, cushion your feet, will help you be more stable and steady on your feet. Know how to properly use your mobility aids such as a cane, walker, or wheelchair. And then just read more about this topic. Educate yourself and your family And anybody else that you're working with, maybe talk to your healthcare provider about fall prevention. And then if you do happen to fall, talk to your doctor about that. Because again, they maybe will want to go back through that medicine review and make sure if that's it could be causing it, or if there's some other health condition developing that needs to be addressed. Here is a snapshot of the Stand Up to Falling physical activity publication that has the directions for those stretches and exercises that was mentioned in the PowerPoint. And then also this is the medication publication that goes in the series that has that medicine log included in it that you can use to organize your medicines and be sure you have that information all in one place to share with your healthcare providers or your family members, anybody that maybe would need that. We always finish our extension programs with an evaluation. So if you have been provided the end of program survey evaluation, please complete that and return it to the extension office. And then just as a reminder that this program is developed through the University of Kentucky Cooperative Extension Service through the College of Food, Agriculture, Food and Environment, and in partnership with the UK Healthcare Level 1 Trauma Center. It's a very complete program, and if you would like to share this information with family and friends, we can always get more information to you.